It's much better to prevent high blood pressure than to take medications once it's already there. Let me tell you how you can easily avoid this common condition. So when we look at blood pressure, there are two main numbers. The top number is called systolic, which is a pressure on your arteries during the maximal contraction of your heart. The bottom number is called diastolic, which is a pressure on your arteries when your heart is relaxed. Now, if your top number is constantly over 140 and your bottom number is constantly over 90, then I would class you as someone suffering from high blood pressure, the fancy medical term being hypertension. Now, if you are suffering from this, I would recommend you start recording these numbers down. And you should do that maybe 2 to 3 times a day at different times, be it the morning, lunch, and evening. Whilst you're doing this, make sure you book a visit to your GP so they can organize a 24-hour blood pressure test. High blood pressure damages your blood vessels throughout your entire body, from your kidneys to your brain. It affects your eyes, it affects your lungs, it affects your heart, and it ends up causing many more complications long term. And with the pressure being always higher, this can significantly increase your risk of having a heart attack, having a stroke, heart disease, and even kidney disease. And what makes it even worse, to start with, you generally don't have any symptoms. There's no warning signs until there is some sort of a serious complication. And this is why we call high blood pressure the silent killer. Now, there are lifestyle changes you can make to get this lowered naturally. And I can pretty much guarantee you that if you follow these simple lifestyle choices, you're going to see positive results. So let's get into it. The two bad habits that are proven to increase your blood pressure is heavy alcohol intake and smoking. Now, when we say heavy alcohol intake or heavy alcohol consumption, that means drinking more than 14 units per week. The majority of patients I speak to that do suffer from this, they generally do get confused with how many units there are in a drink, or they find it difficult to calculate how much they drink in a week. So what I could do here is give you an online calculator. I can give you an app to use, but I'm gonna make it very easy for you if you do suffer from this. Don't drink. There's nothing good which comes from alcohol. So trust me, in the long run, even your liver's going to thank you. Just cut it out. When we speak about smoking, we mean smoking in any amount, whether it's 1 cigarette a day, 5 a day, 10 a day, 20 a day. I mean, this is going to have a huge impact on your lungs. There's no positives in smoking, so avoid it at all costs. Your blood pressure is going to thank you, your lungs will thank you, your heart will thank you, and also your bank will thank you, your savings will thank you. So quit this habit. There are lots of alternatives you could use to get off smoking. One of them, which is quite common nowadays, is to suggest vaping, but I will never suggest vaping as an alternative to smoking. And this is because, in my opinion, vaping is the next killer, the next addiction for the next generation to see. My strong advice would be, if you have the willpower and if you have the right support network around you, just go cold turkey. I always say cold turkey is the best method. The reason being is you're not replacing an addiction with another addiction and essentially rewiring your brain. It will be a painful period, but in the long term, your body will thank you. Now, salt. There's a lot of evidence out there to show the direct correlation between salt and hypertension. Now, a large consumption of salt raises your blood pressure, and this is because when you consume a large amount of salt, you will naturally hold more water within your circulatory system, and this in turn increases your body's intravascular volume, therefore raising the pressure within your arteries and making your heart work a little harder. Just by reducing your intake of salt to maybe around a teaspoon a day, which is equivalent to 5 to 6 grams, has been proven to reduce blood pressure naturally. Also remember that it's not just about the salt you add to your food. When shopping, make sure you read the food labels before placing anything into your cart. Most sodium we eat is hidden in processed foods, such as even tomato sauce, condiments, canned foods, and prepared mixes. Always read the nutrition facts on the rear labels. Look for words soda, sodium, and the symbol Na on labels, and these words show that sodium is present. Sleep. Now, sleep deprivation has been shown to increase blood pressure during the day. Try to get a minimum of 5 to 6 hours of sleep per night. Coffee. Now, if you drink more than 4 cups a day, that will raise your blood pressure. So if you're a big fan of coffee, tea, or any of the drinks that contain caffeine, try to cut down to maybe 2 cups a day and have it at the right times. Your cutoff time for caffeinated drinks should be around, let's say, maximum 3 p.m. Be more active. Aim for 30 minutes of moderate intensity exercise for at least 5 days per week. Now, if you don't exercise, obviously build yourself up. Start off 1 day a week, 2 days a week, 3 days a week. Build yourself up to 5 days a week, 30 minutes a day. And this will help you cut down your weight, which again will naturally reduce your blood pressure. Again, ladies and gents, I always tell my patients and clients that prevention is better than the cure. It's better to prevent getting high blood pressure than to take pills for once it's already there. I'm now reverting back to my pharmacy days. I know my drugs, and I can tell you blood pressure medications, which there's lots of them, have tons of side effects. So why on earth would you want to choose this option of pharmaceuticals when you have a natural choice? So guys, follow these very simple tips, live a healthier lifestyle, and let's get that blood pressure working within the normal range. Thanks for watching, guys. I'm new on this channel, so please make sure you like, comment, and tag your family, your friends who will find this information useful. Inshallah, I'll see you for the next video. Take care. Assalamu alaikum.